Time is 8:45. It's a quarter before the top of the hour. Let us meet our newest physician with the IRMC Physician Group. She is Dr. Quiniece Hurdle, OB-GYN at IRMC. Good morning.
Good morning. How are you?
Good to meet you. My goodness, I've heard a lot about you.
Thank you.
I've heard a lot. And you've been here in Indiana for how long?
Since August.
Since August?
Mm-hmm.
It's a little bit different now than it was in August, isn't it, in terms of all
Very
this?
different.
And you actually have spent a lot of time down south, so this is a new experience for you?
Very new for me. The snow and the cold, but it's a good experience.
Oh, that's good to hear. Good to hear that it hasn't got you down yet.
No.
OB-GYN at IRMC.
Yes.
This is one of the few facilities left which is able to support a maternity ward such as IRMC does.
Yes, absolutely.
Tell me about making the decision to come to Indiana.
Well, I previously worked in Arkansas for a few years, and being originally from Virginia, I decided to get closer to home and interviewed here and loved it. Really fell in love with the place, the people, and it was a great decision.
Yeah. Now, where you've been before, has it been a community of this size, larger, smaller?
Actually smaller.
Smaller than this?
Yes, where I came from, it was a rural town of about 10,000, so a bit smaller than here in Indiana.
Mm-hmm.
Yeah.
So as you come here and you therefore experience a whole new culture,
Yes.
and a town that's a little bit larger, but it isn't a big city by any means. Are there differences when you come from a smaller environment to this one, which is larger, or whatever experiences you might have had at larger facilities?
Well, there are some differences, not too much from where I came from in regards to being in a smaller town. But compared to larger cities that I've lived in throughout my training, there are some bigger differences. Just because, for example, I've lived in New York, that can be quite a difference. But yeah, I mean, it's not so much of a huge change, just the weather, really.
Yeah, well, there is that to contend with.
Yes.
But you've actually you bought a house here in Indiana?
Yes, I did.
Yeah.
In
Do you
the
have a family?
Fairfax division. No, I don't have a family. My mom and brothers and sisters there in Virginia, but I don't have a husband or any children just yet.
So you're out on your own here.
Yeah.
In the big town.
Yeah.
Let's talk a little bit about women's health and
Okay.
in particular the areas with which you are concerned.
Okay.
And again, I would tend to doubt that the issues that women experience health-wise here in this area are much different from anywhere else.
No. Wherever you go, there are the same basic issues that women deal with. So there's not much of a huge difference. And I mean, it's important to bring compassion and obviously have a knowledge base of what you're supposed to be doing. But I mean, women are the same everywhere.
Yeah. When you do what you do, so many people focus upon pregnancies and having babies, and that is obviously very much what you do.
Right.
But overall, gynecological health, it really doesn't have an age barrier, does it? You have to care for yourself in that respect, no matter what age you are. But the issues are different.
Yes, the issues can be different throughout a woman's life, even from the teenage years up until menopause and afterwards as well, especially since we're living longer. I mean, the issues may change, but a woman's the same. You just have to kind of not know what to expect throughout each age of a woman's life.
Menopausal issues and beyond, postmenopausal issues for women. What are the things that women need to know that I don't want to say they neglect? But once you get past the childbearing years, maybe you do let slide some of the visits that you should be having, and some of the issues that you might be experiencing might be related to that. Right.
So after the childbearing years, it's still important to come in for physical exams. For example, continue pap smear screening, breast screening, and also for monitoring of your blood pressure and screening for other issues such as hypertension, diabetes, and thyroid disease as well. So it's definitely not something you want to neglect. A lot of women think that, once they're done with childbearing, that there's not really a lot that they need to care for, but there is quite a bit still. So coming in for your yearly visits is still important, and it's recommended.
Yeah. Is there a connection between gynecological issues that women might be experiencing and other diseases or other areas of their health that they're not making that connection to, understanding that this was something that had you been coming for a yearly exam we might have been able to catch this, or we might have been able to diagnose that?
Yes, I think so. And even, for example, in pregnancy, certain conditions such as preeclampsia, studies have shown that it can have links to hypertension later on in life, for example, or if someone had gestational diabetes, that can be linked to having diabetes outside of pregnancy. So that history is important, and we do continue to screen for those things after pregnancy when you guys come for your yearly visits. So it's important to develop relationships and come in for your yearly visits, even if you don't feel that anything's wrong.
Yeah. We're talking this morning with Dr. Quiniece Hurdle. She's the newest OB-GYN at the Indiana Regional Medical Center. Has been here since August. We've been talking about menopause and postmenopausal women. Let's get into the childbearing years and some of the issues that you mentioned from the teen years and into those early years of your 20s and maybe up to the age of 30. There are certain benchmarks, I'm sure, that you need to look for when you're deciding, okay, it's time for me to be seeing an OB-GYN such as yourself.
Right.
What are those?
Well, for example, before one considers pregnancy, it's important even for young females from the age of 11 to come in and get acquainted with the office. There are certain vaccines that are offered that can prevent against cervical cancer. And then once the time comes to consider childbearing, preconception care is also very important to make sure there aren't any things that, one should be screened for before even considering pregnancy. So those things are important. And then once it comes time to having children, obviously coming in for your visits, monitoring for appropriate growth of, the baby and also yourself. And the milestones throughout pregnancy is important as well.
Yeah. Nutrition must play a key role when you become pregnant as well.
Yes. And being healthy before pregnancy is key to that.
Okay. And obviously behaviors such as smoking and alcohol consumption, those all play a role in the health of your baby and of yourself.
Yes, absolutely.
Yeah. Wonderful. All right, so we're talking about some of the issues that are involved with OB-GYN care. Obviously, I'm not well-versed in this.
Well, you seem to be.
But as you work at IRMC and people come to you and you see some of the things that happen, we hear rates, mortality rates, infant mortality rates that are very, very, especially childbirth mortality rates that are very, very distressing for a country that is developed as America is.
Right.
Why is that?
Well, I think a lot of it has to do with the patient and certain medical conditions that she may have that unfortunately may make the pregnancy more high risk and increased risk of mortality to the unborn child. And then also there are certain conditions with pregnancy that may increase the risk of death to the baby as well. So it kind of depends on the situation and certain behaviors that a patient may undertake as well can impact the baby, obviously.
Yeah, and you were talking a couple of moments ago about being healthy before you enter into it, considering pregnancy.
Absolutely.
There is an obvious, very unfortunate situation which has arisen more and more in the last few years, and that is babies born addicted to opiates.
Yes.
Obviously, that is something that you have to be very, very concerned about, too.
Absolutely. And I think the state of Pennsylvania has done a good job in trying to make sure that all physicians are prepared and take appropriate courses in learning how to prevent continued opioid addiction. But that is key. I mean, some women have issues with that, and it can affect the baby.
You raise an interesting point there. The state of Pennsylvania, of course, has its standards with which you must comply, and and you have to know what those standards are and make sure that you're in line with that.
Yes.
Does it differ greatly? You mentioned you were in Louisiana, you were in Arkansas practicing there. Does it differ greatly state to state what those standards might be?
I'd say that now it doesn't. I think all of states are getting on board with making sure that we're certified in opioid addiction in regards to things to look out for and preventive behaviors that we need to take in order to make sure that women don't get addicted to opioids. But nowadays, across the board, it's important to check each state's database in regards to making sure patients aren't at risk for opioid addiction.
And in the gestational stage, when the unborn are affected
Right.
by it, is that something that you can diagnose very early, or at some point during the pregnancy that there might be an issue with that?
Well, if a patient herself is on a certain medication, then it's kind of assumed that there's potentially an issue in regards to the baby being addicted to the medication when the baby's born. So that's something we have to prepare for.
Well, we've been running all around the issues here with you today,
Yes.
haven't we? Putting you
Yes.
through the through the mill here to
This is good.
to find out about. Well, it's all about education,
Right.
And women need to be educated as to what the issues are with gynecological health. I know that you recently did a seminar, didn't you?
Yes.
Having to do. Tell me how that went.
Well, myself and Dr. Dan Clark, we provided some information to the community in regards to preventative health, in regards to certain types of gynecological cancers, and then also breast cancer, of course, which is his specialty. And it went really well.
Yeah.
We were able to answer a lot of questions and provide information. So I think it's something that is definitely a plus in regards to the community. And also myself, and meeting people and
Yeah.
getting to see patients face to face.
Lots of people out there listening this morning, and maybe a few of them are wondering, okay, she's just raised a few issues, and I don't have a gynecologist. I don't see a doctor. How do they set up visiting with you?
Okay, so I am located at the hospital on Tuesdays in the surgical center, and then every other day during the week I'm at 119 Professional Center, Suite 200. It's the same office as Dr. William Lear. So all one has to do is essentially make an appointment. There is a call center that actually takes patient calls and can route the patient to wherever they need to be, where I'll be at that area. That number is 888-452-IRMC as an Indiana Regional Medical Center. Once again, 888-452-IRMC. So they can just give that number a call.
Beautiful. So good to meet you. Thanks for coming in.
Same here. Thank you.
We
Thanks for
appreciate
having
it.
me.
That's Dr. Quiniece Hurdle with us here this morning from the IRMC Physician Group, and obviously she's done wonderful work already here in Indiana County.